Great. Question one, like our primary learning style. So part A, what describes us the best? So I can start. I feel like the harmonious describes me the best because I like to like want everyone to be able to agree and like come to a consensus that like everyone is okay with versus someone kind of like getting something they want versus another person like not happy with it.
I got resourceful as my top one, so people who are driven by practical results, maximizing both efficiency and returns for their investments of time, talent, energy, and resources. Oh, that was pretty accurate. I mean, I like to like obviously get the most out of like the time I spend on stuff, so that was pretty accurate.
I think the one that really describes me most is that I'm really consistent. I try to stay on a schedule and I try and keep at it and, not try and sway too far from the schedule. And I think that's how I get a lot of my best work done is when I stay on the schedule and just don't try and, make free time for, whatever. If I'm just very structured, that's how I work best.
Then the next question was which descriptor did you feel like didn't describe you? And I feel like mine said structured. I feel like outside of school sometimes I'm not structured. I'm very like spontaneous. So that's probably why it turned out like that because it wasn't always asking about like school or work. But I feel like when I'm involved in school or work, I like keep to a strict structure because it helps me like stay on task, kind of like Ethan was mentioning earlier about that kind of thing. So.
And for me, I get listed selfless as the last one on my list. So I like to think that I'm not like super like selfish or anything. And I don't know, I probably wouldn't put that last on the list, but that was one I kind of didn't fully agree with.
Yeah, mine said that that I wasn't competitive, which is absolutely 100% wrong. It had a like 11 out of 12. I'm super competitive. I don't like losing. I want to be like the best at everything. Like I always try and get the class high in an exam or something, or I always want to win the tournament, or even if it's like paper football, I want to win, or cornhole, or just something, anything. It just I don't want to lose.
The next one was about slide 24. So I guess we can all just share our like the letter that we got, and then we can kind of compare the conflict versus who will understand each other the most. Because I had a high I, so influencer.
All right, I had a high S, but I also had a pretty high I.
So I was a high S, but I also had a very high C. It was like right behind it.
So like here was the chart that they had on 24. I'm not sure how we want to interpret it. I'll hold it to my screen.
Yeah, so like in my instance, like it looked like there that S and I were kind of paired up, like overlapping. So it kind of looked like sometimes their styles usually do like, I don't know, match together pretty well. So I mean, the chart kind of shows that in my case, that they do overlap. They're almost like equal, really. So.
And then to each other, I know you said you were S and I. Ethan, you said you were, what were you again?
S. So yeah, kind of like what Jeff said, like S's have like a lot of overlap with pretty much all the other styles.
Yeah.
So I guess you and Jeff would really be able to collaborate well. Mine was a little bit like halfway, so it was still good because also Jeff had an I, so we kind of overlapped. I feel like none of us were in the categories that were like super far apart, like S and D. So I feel like in our group situation, it was saying like, would people have difficulties understanding each other? I feel like we would be okay, and you guys would just get along better, it seems. So the next question, it was just like two different scenarios. it said like a person with a high S, how would you like use strategies for? So um I saw like like you want to make like for a high S, you'd want to make sure like you get show that you care and like kind of be personal in the beginning versus like just rushing right into it.
You kind of want to like, I would say, build a relationship with them, because if you just, as a physical therapist, you just walk into the room and say, you do this, you do that, you do that. Person will be like, whoa, why? Like, I'm not really keen to you just coming in here and pointing fingers. I don't really like that.
Yeah. Versus like the high C. Do you want to talk about that? Like the high C was like really trying to make it structured. So like, I don't know, Jeff, you want to say something about that?
Yeah, so I guess if you're approaching someone with like a high C personality, um, like they're gonna want to feel like you have things kind of down, like in your head on a line. So maybe that you want to have like kind of give them a plan for the day, like tell them like exactly what you're gonna go through, kind of like within the hour, whatever you're with them. So they kind of have in their mind that like, okay, they're gonna do like get these things done at this time, and maybe they'll feel more comfortable and like
Mm-hmm.
I don't know, maybe they'll like accept your help and you'll develop like a better relationship with them, knowing that you're trying to give them like the structure and function that they want.
And the next,
Kind of piggybacking off of that, my fault, man.
no,
But
you're
piggyback off of that, I know that they're also, they want to kind of have the information. They want to have like all available information on the subject matter, if not beforehand, but very early in the program. So kind of like, I'd imagine giving reasoning and like research results on this. Like if I was going to do like blood flow restriction training on this patient, this does this, it, utilizes this pathway and stuff. So kind of like giving information so they know, like they're in the loop and they can, go home and look it up themselves and like actually like dive even deeper into it. I think that would also be beneficial.
And the next scenario is just talking about like rather than communicating with a patient of a high C and high S, it was talking about like a physician. So I was going to say if you were talking with a physician of a high C, you would want to maybe like have pre-written notes that you're going to like make sure that they can even have access to and be like, this is what happened to the best of your knowledge. This is the time it happened. And kind of like you can introduce yourself, but more just kind of get like right to the point.
So I think
Yeah, definitely.
That
Go ahead,
scenario
Jeff.
said, like you're calling a physician to inform them of what happened when a patient recently fell in your clinic. The physician has a high C behavioral style. So like Ann said, like if they're gonna like show up and you try and tell them what happened, like you guys said, they're gonna probably just want to know how the patient fell and like what exactly happened. Like you probably don't want to like beat around the bush saying like kind of like making excuses and stuff. You kind of probably just want to like tell them what happened, tell them what you could have done better, and kind of discuss like, the hard truth of it all.
Mm-hmm. And then the next one was just talking about a high S for a physician interaction.
So I know that you definitely want to make the high S group, make them feel welcome. So I would, ask for their expertise. That they're, that they're passionate about this and they want to be kept in the loop, and that you value their opinion. And you would ask for their opinion on what happened, or you'd be very, I guess, more sincere as opposed to real cut and dry. But still tell them what happened. Again, don't beat around the bush, but be, sincere about it, and apologetic if it was on your behalf, like if it was your problem, but tell them how it is, but don't just cut and dry like patient fell, he's fine. That's it.
I agree. The next one is like, I guess we would all share our 4 driving forces in the DISC evaluation. So I can share mine first. I had receptive, harmonious, resourceful, and instinctive. And I feel like they were all pretty true. Like receptive talked about like learning from your new experiences and being driven by that. And I feel like I really am like interested in learning from past, like learning new things. And that's like what it was saying. So I feel like I'm always, that was definitely the top. And I feel like that was true. Harmonious, I already kind of talked about. Resourceful, which I know someone else had already mentioned, like with max efficiency. I do like always want to get my work done as like efficient I can. So get it done in the appropriate amount of time, but also like get it done well. And then instinctive, I feel like I do learn a lot from my past experiences. Like I like to take what I've experienced and use it for the future. And I guess it says like which aligns with your choice of becoming a physical therapist. I feel like they all do, because like you need to be able to take past experience, understand it. You need to be efficient when you only have X amount of time with the patient. You need to make sure like it's working for you and for them, not just one person. And then like you also need to be able to learn different things, because not the same old things are going to work for every patient.
You can go first, Ethan. They're vacuuming, so it's pretty loud.
So my 4 main driving forces were, number one, I was very objective. I'm resourceful, intentional, and intellectual. So I think that, I think all those are really good descriptors of me. I am very, very intellectual in the fact that, I do like learning, and I still, after, I leave, I do want to continue my education and, keep building myself as a physical therapist. So I have, that I can be versatile in whatever I need to do. Intentional, says you were driven to assist others for a specific purpose. I think that's important for a PT. Like that comes in, like they're in here for a purpose. I'm not just helping them to, help them feel better. It's, well, yes and no, but I'm not just helping them to help them. They're coming in here with a problem, and it's my job to help solve that problem. And I think that's the most important for being a physical therapist. Resourceful, maximizing efficiency and returns on their investments. I value my time very. That's one thing that I keep very valuable to me. Don't waste my time is like one of my biggest pet peeve, is my biggest pet peeve of all. And then objective was driven by the functionality and objectivity of their surroundings. Yes, I'm very, very just cut and dry with it in terms of that. So pass it off to Jed.
Yeah. So my top 4 are resourceful, instinctive, intentional, and receptive. So I think I already said a little bit about being resourceful and getting like the most out of my time. And like Ethan said, like I also have the same pet peeve, like when people like try and like waste my time in a sense. Like it really like it does bug me, because like I just think about all the ways I could use my time better and like more efficiently. And then instinctive, it says people who are driven by utilizing past experiences, intuition, and seeking specific knowledge when necessary. I think that's pretty accurate, because I always like to look back at like the things, like I'm very open to looking back at the things I'm doing wrong in situations, and then building off of it. And I usually take a lot of repetition to like learn certain skills and stuff anyways. So I think it's pretty accurate that it says I would look back at utilizing past experiences to help like with the present ones. So intentional, it says people who are driven to assist others for a specific purpose, not just for the sake of being helpful or supportive. And also, like Ethan said, when you're helping like a patient on physical therapy, I think it's important to like have the one-on-one relationship with them, and kind of empathy where you want to help and be supportive, but in the end of the day, they're like coming to you for service, and um, everything you should do in the clinic to like help them get better should be intentional and should have a purpose behind it and getting to the end goal of them getting better. Receptive, it says people are driven by new ideas, methods, and opportunities that fall outside a defined system for living. I'm always open to like new ways of doing stuff, so I know that I'm not always gonna be doing the right thing all the time. So like I think we've heard a couple professors say so far, and like physical therapists, um like they've had experience for tens of years, and like they still like say they aren't experts on stuff. So I think it's important to be open to like new ideas and new ways of doing things. Like new research comes up all the time, so I think it's important to be like receptive of that and kind of take it all in, and then I think you'll only be better for it in the end. So I think that pretty describes me pretty well.
The next question just said if we choose someone in our group that has an opposite primary driving force, and I noticed that Ethan and I both he had more of an objective, strong point, right? And then I have one of more harmonious, and I feel like that's kind of, it could impact the interaction, but I feel like you could also like work, like you could find a good like middle point, because like subjective, sometimes you need to be subjective about things and be able to include like the patient's feelings and like how it's impacting them, but sometimes like it has to be objective because that's just how something needs to go. So I feel like,
Yeah, I would say like, and especially since we're in a healthcare field,
mhm.
healthcare isn't always nice, and it's not always what you want to hear. It's something you have to hear sometimes. But there is sometimes where you do have to be harmonious in the fact that what you are telling them is sometimes bad information, not bad information, but not good to hear. So being, taking in the surroundings and knowing like, this person has just gotten this diagnosis. Like I need to be warm to them, but also let them know that I care and that's what I'm here for. So, and I know I agree with Ann that you have to almost work together as a team, and there has to be an objective point of view, but there also has to be harmonious.
Yeah, I was gonna
Yeah.
say definitely that team aspect would kind of, even though they're opposites, that would be like a good opportunity to team people up that have one from each side, because you kind of need both.
Yeah, and I think, like you guys already said, it's like kind of all about finding that balance between like sympathetic and caring, but then also like giving them like the like kind of the final like results, and kind of having that objective approach of like, all right, so how are we gonna like move on from here? So
The next question, we have to do like an S bar. So do you want me to like read the scenario so we're all familiar with it, and then we can go from there? Um, you are a PT in an outpatient clinic, and the patient who you are evaluating walks into the clinic carrying a set of crutches. When you look at their prescription, you see that the patient should be, I'm not sure what these terminology. Do you guys know what the terminologies are? Non-weight
It
bearing, lower.
has it right next to it.
Oh, non-weight bearing left lower extremity status, post left ankle fracture. The patient states, "These crutches are horrible and I can't use them, but don't worry, I have been real gentle with walking around." When you examine the patient, their left ankle is painful, 8 out of 10 to touch, red, swollen, and their sock is slightly wet to touch. Patient states that their foot started to ooze a day or so ago, but they thought it meant it was healing. So I guess we can pull up those slides with the S bar and just kind of go through it from there, if you guys are good with that.
yeah.
I could just like read the description of each one and then we can talk about it.
Okay.
Situation. What situation are you talking about? So identify self, location, patient, and then state the problem, what's happening, and the severity.
So I think I would start as, hi, Dr. X. My name's Ethan Hurd. I'm a physical therapist here at Clinic X. I have a patient here who has come in with symptoms of maybe a foot infection following a surgery on a left ankle fracture. Patient is supposed to be non-weight bearing. I think that's.
Yeah. And then just maybe like mention that they're not using the crutches. So.
Yeah.
And then, I guess any other information we have on the patient, but we don't have like their name, date of birth, or anything like that. So.
Mm-hmm.
I mean, you should probably definitely figure that out, like when you call them, like kind of talk to. You can originally approach the patient and be like, "All right, like I don't know, let's sit down and have like a short discussion over it, and then maybe you would do your like evaluation of them if they were coming to see you, and then call the doctor." And like Ethan said, like I liked how he put it, like kind of like quick and dry. Like you don't want to give them like all these extra useless details. So I thought that was good.
Yep. The next one is the background. So like pertinent information, their diagnosis. Oh, I hope that it doesn't run out of time.
Oh, it should be okay. After this.
The list of treatments, outcomes, and clinical relevant information. I feel like we don't have all of it, but in a normal situation we would. So we can tell them that of what the prescription, and tell the doctor that it is a non-weight bearing left lower extremity status post left ankle fracture, and then whatever medications that they have will like inform the doctor, because we'll be in our eval, we would have found out that which medications, and then like just clinical information, like if we had been treating them at all before this specific meeting, and kind of like that information.
Yeah, I think you can discuss, like you can tell them like probably the specific details, like red, swollen, and starting to like ooze. You can probably give them like a pain scale for the patient and see how. You could say you like tried to aid them in walking on their crutches in the meantime. So like I don't know, it would personally be the first thing I would do. I'd say evaluate it and then explain to them like the importance of like walking on your crutches, and then try to get them walking on their crutches until they at least can go see the doctor.
Mm-hmm.
I would also kind of add that the patient is expressing a lot of pain with the crutches, leading to walking on their foot and possibly getting maybe a prescription for a wheelchair or a scooter, something that wouldn't be as painful. That I definitely would add that in there. And that, again, that, it's 8 out of 10 on the pain scale to touch, to ooze, and this, and then you could kind of like bleed right into the assessment. And that could, what I'm assessing is it looks like the foot may be infected. That there needs to be some type of like I think it was like Jeff was saying about the was it the or was it Anna was talking about medications?
Yeah.
Somebody was talking about medications, but kind of go into the medications and maybe like adding on to the medication list.
Mm-hmm. And the next one is assessment. So is the patient not tolerating intervention? Is the patient have a significant change? I feel like this is the time that you also would kind of go into that detail with their issue with the crutches, like kind of how we mentioned before, but like make sure it's stated there, and like especially if that physician was their surgeon, explain like that the oozing and the crutches issue, because they obviously sent them home following that, and now that's kind of like a change or what they're not able to tolerate.
Yeah, and I think you can just even ask them, like, it says the patient said these crutches are horrible and I can't use them. You can ask them like why they're so horrible and see like what about them they aren't liking. Are they not liking that they're like hurting their like armpits, or are they just not using them properly and like not getting around quick enough, or things like that. So you can kind of say like that the patient isn't tolerating like the crutches and the treatment you prescribe, but then give them like a reason like why it hasn't been working, so they like have something to go off of when they talk to the patient. They can be like, oh, I heard like this is like hurting you, these are hurting you, like maybe we can like pad it for you or something, or give you like other means of getting around like a wheelchair or something. So, and also like I was thinking if this meeting time ends, you can probably just like submit this one and then like another one, you
Yeah,
know?
because it's saying five, it's having a countdown, but I
Yeah,
think
I see that.
sometimes it just lets you keep going.
Okay, we'll see.
So, what are your clinical recommendations? This is for the R part. So it's saying like patients needs to be evaluated by the physician, change in treatment, referral, and specific examinations or tests.
Yeah, I think I mean, you'd almost have to just request the doctor, the physician to see it, and check it out to see what's really going on. I mean, as a physical therapist, you can't really diagnose, but you can refer out to the doctor to actually give a diagnosis and maybe change up put them on an antibiotic to get rid of the infection, or assess if there is an infection. But yeah, you definitely have to refer that out and ask for them to evaluate at the very least, and look at maybe even, if crutches is out of the picture, there has to be some type of way that they can get off that foot. Even if you can pad it and they're still complaining about, oh, it hurts, but either way they have to get off that foot, or that's not going to heal properly.
Mhm. And then I'm guessing like you could do some of your just the general like tests that you do in the beginning of a PT eval. You can do whatever tests that you're able to do with that current injury. So,
I think, and I think overall, like the situation's basically, I feel like we're trying to get at like, as a PT, you got to recognize like kind of how far, and we've been talking about it a little bit, but how far like your role as a PT goes versus like when you should refer the patient out for extra help. So I think, like we've been saying, a big part of our job is just like identify those factors, and like it seems like we're the first person that's seeing this patient with like the swollen ankle, and like they like the doctor probably thought they sent them on the way and they were okay, but in reality they were having this and their foot's starting to ooze. So I think like Ethan said, like it's important to like distinguish those and then like definitely refer them to help.
I guess that was pretty much it for the SBAR. So the next question was like the terms mentoring, mentor, and mentee. I guess we can all maybe just talk about one of them if you guys are good with that.
Yeah, of course.
I'll just start with mentoring and then we can go. So I feel like a mentoring position is when like you're in a position where you're like going to be guiding someone to, whether it's, I did like first year mentor, so I was like mentoring freshmen, helping them move in, whether we're going to be, someone might be mentoring us when we're learning, and then eventually we could be mentoring them when we become like a physical therapist.
So for a mentor, I personally I mentored a couple underclassmen last year on our baseball team, that they wanted to get into fitness a little more, and they weren't happy with the team workout, so they would come and work out with me. And I had one of the kids that I mentored was this freshman who didn't really have an understanding on dieting, so I really had to show him how to properly eat, and when to eat bad and when to eat good, like he actually was too strict on his diet, and it was kind of showing in his behavior. So I had to show, just kind of show him, you don't always have to do that. It's okay. But I really I really liked it. And, but it just kind of, like showing him the ropes and showing him tricks of the trade, I would say is probably the best mentor, and just kind of set an example.
And even just using your example, Ethan, like you were definitely the mentor in that situation then. Like discussing the mentee, like the athlete that you were the mentor of would be the mentee. And I see the mentee as anyone, like I'd say we're like going into clinical, like we would be the mentee because we would we'll be the ones trying to obtain all that information and learn like the skills of the trade that we're here for. So
Okay, I'm not sure if it's gonna end, but if it does, I will just start a new one. But I guess we can just start this question and see. It was just like, who in your life is a mentor? And this is actually kind of a question that we have on that voice thread, if you looked into it for this class actually. And I put that, like, I have a friend that is like a current 6-year PT, and I've kind of looked up to her as a mentor because like I have known her since freshman year. So it was kind of cool because like I always kind of saw like how she transitioned from being able to do a lot more socially into like kind of being more strict with her schedule, becoming like into the grad levels. And she's just kind of been able to tell me more about the different teachers, how different classes are, and like, sorry about that. Our Zoom call ended. So I was just saying that, I think I was saying that my friend's 6th year, she was able to like just kind of guide me and show me how things worked. And I still ask her a lot of questions. So I think I covered most of it in the last part of the recording.
Yeah, I think I'm in the same boat as you, Ann. One of my mentors that I really like clung to as a freshman and sophomore, a guy by the name of John Harned. And I still talk to him pretty regularly. And a lot of the stuff that he did a lot of the stuff, the right way. And that's how I'm trying to mimic how I do my stuff. He's, further extending his education, and he was getting, certifications and going through, working at a really cool, physical therapy place. And I'm still trying to, mimic what I do to, get in kind of his shoes and whatnot. So that's probably who I, have come to see as a mentor, especially in the PT field.
yeah, so just from like a different perspective, like we discussed, like mentors can be like in kind of any part of your life. Like I love to like do stuff outdoors, and like I love to like fish and stuff like that. So I look at like my grandfather as like a mentor for me for like pretty much doing like anything outdoors. Like I kind of like learned from him to do like anything I know about like fishing like has come from him, and just like tying knots and doing stuff like that. Like I just look at him for like a lot of guidance and information.
That's cool. I guess we can just discuss what we hope to learn from our clinical instructor. I definitely I'm really excited to learn different techniques and like skills. I know I'm not as nervous about like the patient interaction because I feel like that comes a little easier to me versus like the skills we haven't learned yet. So I'm like excited to jump in and actually be able to see them in practice and maybe be able to do some of them.
I'd say I'm kind of on the opposite. I'm kind of I want to learn more about having the patient interaction. I'm very personable. Like I just like talking to people. Even when I was doing my observation hours, people just kind of like gravitated towards me, and people just like talking to me. And I'm completely fine with talking to people, but having to like ask the questions and go through like the review of systems and like how they do that, I think that's what I hope to learn the most. I mean, I'm confident that we're going to get plenty of techniques in clinical examination, and that just comes with repetitions and one time a week. suffice to actually develop those skills, but actually watching the school instructor conduct these like interviews and kind of walking me through how it would do that. I think that's what I hope to get the most out of.
Mhm.
Yeah, I think I'm kind of right on with what Ethan said. So like, um, the hands-on skills, I think I'd like love to learn and like observe them, but definitely like just approaching a patient and like asking like the individualized questions like to each one of them, that like there's not like a set in stone list. Like you kind of got to go with the feel of like what the patient is and kind of follow the lead of their answers for your next question. I think I'm like, I hope to learn like better how like they guide those questions and like move them in like the directions that they can get the most out of like an answer from the patient.
Makes sense. And then our last question was to just like share ideas how to facilitate dialogue with our clinical instructor. And I feel like that was kind of the point of this whole like discussion, because we were learning how different learning styles kind of interact and what the benefit and the like downfall could be. So I feel like once we get to know our instructor, maybe we're not going to know their specific disc style, but we're going to be able to know how they respond to different situations versus how we do, and we can learn from that, or they can even learn from us, just not PT wise, but different ways to interact, kind of.
I think like kind of right off the bat, kind of when you meet someone like that or like a mentor like that, you kind of get an idea of like their personality. Like, do they have like a sense of humor? Do they like to talk a lot about like and just like be relaxed about it? Or do they like to get right to the point? So like you kind of pick up on those things, and then like you can start your dialogue and like interactions with them different from day to day. Like you kind of know, I think from that, like their expectations a little more, and you probably develop like a better relationship with them and work better together.
Yeah, I was right along with what Jeff said. Just like a little experience I had this past summer is I was kind of interning with this guy who has a training facility in my hometown, and I never really knew him personally. We knew of each other, and if we saw each other at a restaurant, we'd say, "Hey man, what's up? How you doing?" But then when I actually got into the facility with him and was actually watching him, you know, talk to his clients and how he would talk to me, it was a, you know, right away you learn like so much about how a person talks or how they, hold the conversation, and how you can actually talk to them, I guess, how the way they talk to you. Because just kind of like matching energy. So right away I was like really comfortable with asking him a lot of questions and stuff, and how he would explain it, and he was always laughing, and we were having a good time. And I think that's how you would kind of facilitate dialogue, kind of be more formal at first,
Yeah.
but try and figure out like, okay, am I able to like crack a joke with this person? Am I able to be sarcastic? Am I, and can't really get that on an email. But that's definitely a face-to-face interaction, kind of go with the flow kind of thing that you have to do.
Yeah, I definitely agree that like how you want to start off professional, but then you want to become more comfortable, but still in like a professional way. So, does anyone have anything else to add? Because I think we covered all the questions and had good discussions.
It's good.
All right,
We're good.
stop.